Okay, so the next chapter is lymphatic and immunity, and I'm going to break this up into several recordings. The first one will primarily be the lymphatic system. Okay. So the immune and lymphatic systems function together in what is broadly called immunity, which is a set of diverse processes that are put in place to protect the body from both cellular injury and disease-causing cells, and various molecules referred to as pathogens and/or antigens. The immune system works to defend the body against internal and external threats. It does not contain any organs or tissues, but instead consists of cells and proteins present in the blood and tissues of other systems, including that of the lymphatic system. It does include formed elements known as leukocytes, which are your white blood cells, and we talked about that with the blood chapter, and various immune proteins located in the plasma, such as antibodies. The lymphatic system, on the other hand, this is a group of organs and tissues that not only works with the immune system, but also participates in a number of functions, such as fluid homeostasis. And there are two main components to this system as well. The lymphatic vessels are a system of blind-ended tubes, and then the lymphatic tissue or organs, which include clusters of lymphoid follicles such as tonsils, as well as your lymph nodes, spleen, and thymus. And we talked about the spleen with the blood chapter with red blood cells, as this is the graveyard for where those red blood cells eventually end up. The lymphatic system's basic functions is regulation of interstitial fluid volume. In one of the last recordings with blood vessels, we talked about on the arterial end of the capillary, you are going to be moving more fluid out than you are bringing back in at the venial end. And because you're moving out more fluid than you're bringing back in, the regulation of the interstitial fluid that's going to continuously accumulate as a result of that needs to be picked up by another system, and that system is the lymphatic system. So the fluid loss from plasma is about 2 to 4 liters per day, which if you think about blood, you have about 5 liters. This fluid must be returned to circulation, or both blood volume and blood pressure were dropped too low to maintain homeostasis, and in that case, maintain even life. The lymphatic vessels will pick up that excess fluid in the extracellular space, transport it through the body, and deliver it back to the cardiovascular system. When the fluid exits extracellular space and then enters into the lymphatic vessels, it is known as lymph. The interstitial fluid and the lymph are similar in composition. You then have the absorption of dietary fats, which is how fat is absorbed into the body. Most nutrients will be absorbed in through the small intestines via the capillary networks. However, fats will end up going through the lymphatic network and then eventually put into the blood. So the breakdown products of fats in diet are too large to pass between the endothelial cells and the capillaries. And you'll see in a minute that the actual opening into the lymphatics is a little more larger than what you would see for a capillary. Dietary fats instead will enter small lymphatic vessels referred to as lacteals, which are located within the small intestines. They will travel through lymphatic vessels, and then they are delivered to blood with the lymph. Now, the lymphatic system will also play an important role in the immune system, in the sense that the lymphoid organs will filter pathogens from the lymph and the blood. They will also house several types of leukocytes and play a role in their maturation as well. And here we can see the lymphatic system sort of throughout the entire body here. And one thing that you should notice is that these lymphatic vessels sort of overlay most of your major blood vessels. And, you know, if you start looking at some atlases or even in your textbook, you'll notice that these are green, whereas your arteries are red and your veins are blue in the depictions. But you'll see that a lot of these vessels are overlaying your arterial and venous supplies. Now, lymph is collected into vessels called lymph-collecting vessels, which are going to merge to form lymph trunks. Lymph trunks are just larger vessels. There are 9 lymph trunks that will drain lymph from the specific body regions. These include the lumbar trunks, which receive lymph from the lower limbs and the pelvic area, the jugular trunks, which receive lymph from the head and neck, the intestinal trunk, which receives fat containing lymph from the small lymphatic vessels in the small intestines, and then the bronchiomediastinal trunks. This will receive lymph from the thoracic cavity, and the subclavian trunks, which will receive lymph from the upper limbs. The lumbar, jugular, bronchomediastinal, and subclavian will have right and left components, and there's 2 trunks for each one of those. There's a single intestinal trunk. The intestinal trunk and the lumbar trunks all drain into a large swollen vessel called the cisterna chylae. The cisterna chylae and other lymph trunks drain into one of 2 lymph ducts. The cisterna chylae and the trunks from the left side of the body drain into the thoracic duct, which drains all of the lower body and the left side of the upper body. The thoracic duct is the largest lymphatic duct. It runs along the anterior vertebral column and drains into the junction of the left internal jugular and left subclavian veins, which are going to dump directly into the vena cava. The remaining trunks will drain into the right lymphatic duct, which will drain into the junction of the right internal jugular and right subclavian. And this only drains the upper right side of the body. So here we can see our 2 major trunks. We have the thoracic trunk right here, okay? And that's draining into the left jugular. Draining right into the left subclavian and left jugular veins, okay? And then for the right side, you're going to have the right upper quadrant will drain into the right lymphatic duct, which is located right here, okay? So this quadrant right here will drain into that right lymphatic duct, and the remaining 3/4 of the body, as shown in this image here in blue, will drain into that thoracic duct. The lymphatic vessels will make up low pressure circuits. Now remember, unlike the cardiovascular system where you have that pump, there is no pump located for the lymphatic vessels. Most are transporting lymph against gravity, and you're going to find plenty of valves present to prevent the lymph from flowing backward. Like the deeper veins, often lodge between the muscles, where contracting muscles massage the lymph towards the heart. So they're going to operate much like those veins do, where you have a very low pressure system. Lymph flow through the vessels is driven in part by contractions of smooth muscle found in the walls of the lymph collecting vessels. The lymphatic vessels will begin in tissues with tiny lymphatic capillaries. These tiny capillaries will form a web-like network that surrounds the blood capillary beds. The lymphatic capillaries will differ both structurally and functionally from blood capillaries. The lymphatic capillaries are blind-ended, makes lymphatic vasculature one-way system that only moves lymph away from the tissues. Blood capillaries will form a 2-way system that moves blood both towards and away from tissues. So a little bit of a distinction there between the lymphatic capillaries and your blood capillaries. The cells of the lymphatic capillary walls do not tightly join, and they actually form a little bit of a flap opening and close. And they're going to operate like valves, these little flaps. Fluid that leaks from the blood capillaries increases the pressure in the interstitial fluid. That forces the lymphatic endothelial cells apart, allowing large volumes of fluid to enter into the lymphatic capillaries. When the pressure of the interstitial fluid decreases, the endothelial cell flaps will shut, and this plays a crucial role in the precise control of the amount of fluid between the cells. The vessels are also leaky enough to allow cells such as macrophages and other immune cells to enter into the lymph. The lymph nodes, on the other hand, clusters of lymphoid organs along the pathway of the lymphatic vessels. Pathogens, such as bacteria and cancer cells in the interstitial fluid, have an easier time entering lymphatic capillaries than blood capillaries. Lymph nodes will limit the spread of pathogens through the body by acting as filters and trap the pathogens and prevent them from traveling elsewhere throughout the body. And here you can see you have your capillary network that we saw earlier, and this is going to be the arterial end. Fluid's going to move out, fluid moves back into the venal end here. Any remaining fluid is going to go through this network of capillaries, and you can see that here as the interstitial fluid builds up, the pressure, you can see how that's going to push these cells open and fluid will move in. When this pressure decreases because the fluid has moved in, these flaps will close, and this keeps the fluid moving in this one-way direction. Now, the role of the lymphatic system in regulating volume of interstitial fluid becomes readily apparent in lymphedema. Edema or swelling is the accumulation of excess interstitial fluid. Many conditions can cause mild to moderate edema, including trauma, vascular disease, and heart failure. However, edema seen with lymphoedema is typically severe, and this can actually be disfiguring, as you can see here. Lymphoedema is generally due to the removal of the lymphatic vessels during surgery, with a blockage of those vessels from pathogens such as parasites. Both conditions actually prevent lymphatic vessels from transporting the extracellular interstitial fluid back to the cardiovascular system. Fluid then unfortunately will accumulate in the tissues of the affected body part, causing them to enlarge. The photo shows a case of lymphedema in the arm of a breast cancer patient resulting from the surgical removal of those lymph nodes. Now, the predominant tissue type of the lymphatic system is type of loose connective tissue called reticular tissue. This contains specialized cells and thin reticular fibers that interweave to form nets that trap disease-causing pathogens. The lymphatic reticular tissue is typically called lymphoid tissue, and it is found in lymphoid organs and is also as independent clusters throughout the body that have varying degrees of organization. The lymphoid organs will house various types of leukocytes. We'll talk about these when we get to the immune side of things. But you have macrophages, which are mature monocytes, which are phagocytic cells. B and T lymphocytes, B cells produce antibodies, T cells kill. Your dendritic cells and reticular cells, all very important cells of the immune system there. There's also something called mucosa-associated lymphoid tissue, or MALT. MALT is loosely organized clusters of lymphoid tissue that protects mucous membranes, which are exposed to a large number of pathogens. MALT will protect oral and nasal cavities scattered throughout the GI tract, respiratory passageways, and to a limited extent, the genitourinary tract. So essentially all of your epithelial lining surfaces. Much of MALT in the body consists of loosely organized clusters of B and T cells that lack the connective tissue capsule. Specialized MALT is found in 3 locations of the GI tract: the tonsils, which is located around the oral and nasal cavities; Peyer's patches, which are aggregated lymphoid nodules located in the last portion of the small intestine; and the appendix, which protrudes from the large intestine. There are 3 major types of tonsils: your adenoid tonsils or pharyngeal tonsils. Adenoid's an older name. These are located in the posterior nasal cavity, or what we refer to as the nasopharynx. The palatine tonsils, these are located in the posterior lateral or oral cavity, and the lingual tonsils, which are located at the base of the tongue. The epithelial lining of tonsils indents deeply into several locations, forming what we call tonsillar crypts that trap bacteria and debris. The tonsil location puts them into contact with a large number of potential pathogens, as a result, commonly becoming inflamed, such as tonsillitis. And here you can see we have our pharyngeal tonsils, palatine tonsils, and lingual tonsils. The Peyer's patches, these are also exposed to a large number of potential pathogens because of location. This allows them to defend against any bacteria that have escaped from the large intestines. The appendix, which is a blind-ended worm-shaped tube that juts from the large intestines, defends the body from bacteria in the large intestines, specifically those that could be pathogenic. And here we can see various types of Peyer's patches located there. We can see some malt located in the appendix here. Okay, or this is your appendix right here, a little thing hanging off there. But you're also going to have scattered malt through the entire GI tract, and as we mentioned earlier, respiratory tract and part of the urogenital tract. Now your lymph nodes, these are small, vaguely bean-shaped clusters of lymphatic tissue located along the lymphatic vessels throughout the body. Specific clusters of lymph nodes include the axillary lymph nodes in the axilla, cervical lymph nodes in the neck, inguinal lymph nodes in the groin, and mesenteric lymph nodes in the abdominal cavity. The lymph nodes have external connective tissue capsule that surrounds a network of reticular fibers that are filled with macrophages, lymphocytes, and dendritic cells. The interior of the nodes is divided into two main regions, the outer cortex and the inner medulla. The cortex is going to consist of B-cell-rich lymphoid follicles divided by inward extensions of the capsule. Between the cortex and the medulla is a darker zone composed primarily of T cells. The medulla, in the brown figure shown here, contains rows of macrophages and mature B cells known as medullary cords. What happens is lymph flows into the lymph node through multiple small lymphatic vessels referred to as afferent lymphatic vessels. If you remember from the nervous system, afferent means you're going towards something, so this is flowing in. Then percolates through the reticular network where pathogens in the lymph can become trapped within that network or that quote-unquote net of white blood cells. The trapped pathogens will then encounter those white blood cells, leukocytes, dendritic cells, which will eliminate these threats. The lymph that has been cleaned of pathogen will then drain back out through the efferent, efferent meaning going out, of the other side of the lymph node at the hilum. Hilum is just a structure or point on a organ or structure where you have tubules going in and out, blood vessels going in and out, nerves going in and out. The lymph nodes will trap approximately 90% of pathogens in lymph and prevent pathogens from being delivered to blood where they could easily spread to other tissues and organs. And here we can see a typical lymph node. So essentially what happens is this allows the lymph that has been collected all throughout the body in the various interstitial fluid where you may have an infection and that some of those pathogens will end up in that lymph and then it gets filtered through the lymph node where you have all these white blood cells that are surveying that lymph to see if there's anything there. And we'll take care of it if there is something there. Now your spleen, this is the largest lymphoid organ in the body, and it's located on the lateral side of the left upper quadrant of the abdominal pelvic cavity. It's a purplish brown organ about the size of a large bar of soap. Internal structures consist of a network of reticular fibers made by the reticular cells. There are two distinct histological regions in the reticular network. Red pulp, which contains macrophages that destroy old or broken down erythrocytes, and white pulp that filters pathogens from the blood and contains leukocytes and dendritic cells. And here you can see this is your liver here, here's your stomach, here's your spleen. Okay. The thymus, and remember that the spleen is also your graveyard for your red blood cells. sorry. The thymus, this is a small encapsulated organ in the superior mediastinum. It consists of two lobes that do not trap pathogens. What the thymus does is it secretes hormones that enable it to carry out its primary function, generating population of functional T cells capable of protecting the body from those pathogens. The thymus is also large and very active in children and infants because they are just being exposed to a plethora of very new antigens. Reaching its maximal size in individuals about the age of 12 to 14 years old, and then after puberty, it will start to atrophy because you're not as exposed to many new antigens as you might have once been. At this point, it begins to atrophy. The thymic tissue is gradually replaced with fat, and T cell production declines. By the age of 65, the rate of T cell production falls to about 2% of which it was at your age when you were an infant, when you were being exposed to many things. The adult thymus consists of subunits called thymic globules or thymic corpuscles, which are visible externally as lumps on the surface of the thymus. Each lobule contains two regions, again a cortex and a medulla. The cortex contains densely packed T cells. The medulla contains fewer of these cells, thought instead to be mostly the site of destruction of certain populations of T cells that could react to the body's own cells. There are no lymph follicles in the thymus because they lack B cells. And here you can see your thymus there. And that is the end of the lymphatic system and the end of the first recording. Our next recording will pick up with the start of the immune system.